2 years ago, you injured your back while carrying a heavy item. Although your injury has fully healed and your MRI shows no sign of fracture, you continue to experience aching, debilitating pain almost every day of the week. Sometimes your pain gets so bad that you can't sleep, eat, or concentrate on your work. You've tried countless different treatments, but nothing seems to help. You feel frustrated, trapped, alone, and helpless. Your pain has started to take control over your life and you don't know what else to do. Hello, and welcome to MedTouch, the best place to find the right medical information. We've all experienced pain at some point in our lives, from a scraped knee, a stinging sunburn, to a pounding headache. Pain is a natural and necessary part of life. In fact, pain is your body's way of keeping you safe from potential danger. When you injure yourself, sensors in your body's nerve endings send signals to your brain, alerting it that something's wrong. When your brain receives these signals, it takes into consideration a range of different factors and makes a decision about what type and level of pain to feel and what to do in order to protect your body from further harm. Most of the time, your brain makes the right decision, such as alerting you to pull your hand away from a hot stove in order to prevent your hand from burning off. This is known as experiencing acute pain. Acute pain is short-lived pain that warns your body that damage is occurring. Once the source of pain has been removed or treated, acute pain goes away. However, sometimes incorrect signals travel from your nerves to your brain. As a result, your brain becomes overprotective and excessively sensitive to what's happening around you. This increase in sensitivity causes your brain to continuously send out pain signals in order to keep you safe, even when you're not in danger. When this occurs, pain no longer serves a useful purpose. Instead, pain itself becomes a disease rather than a symptom. This is known as experiencing chronic pain. Chronic pain is extremely complex. It can occur due to chronic conditions or diseases such as arthritis or fibromyalgia, or as a result of nerve damage. It can also occur for no apparent reason at all. Regardless of the cause, living with chronic pain can be debilitating. It can make it harder to work, take care of yourself, and participate in everyday activities. It can also affect your sleep, mood, relationships, and finances. That's why in today's video, we're sharing 8 tips that you can use to manage chronic pain and improve your quality of life. Tip number 1. Seek medical advice. If you've been experiencing ongoing persistent pain that's been interfering with your everyday life, seek medical advice as soon as possible. It may seem scary reaching out for help. You may be worried that your doctor won't understand what you're experiencing, or you may be nervous about what kind of treatments will be involved. However, it's important to remember that you're not alone. Your pain is real, and the sooner you get on top of your symptoms, the better. The good news is, most of the time your doctor will be able to diagnose the cause of your pain and provide you with some much-needed pain relief. However, sometimes even after lots of investigation, the cause of your pain may still be unclear. But don't worry, your doctor will work with you to develop a plan for managing your pain. Your plan will likely include a range of treatments such as medication, therapy, and lifestyle modifications. Together, these treatments can improve your quality of life by helping you cope, manage, and live with your pain more effectively. Tip number 2. Avoid addictive pain relief medications or substances. When it comes to pharmaceutical treatments for chronic pain, it's important to learn what's considered safe and what's considered harmful. Generally, over-the-counter pain relief medicines such as paracetamol or non-steroidal anti-inflammatory medications are considered safe for temporary pain relief. Your doctor will typically recommend these to you as part of your treatment plan. On the other hand, opioids, such as morphine and its derivatives, and substances such as alcohol, smoking, and illicit drugs, are not recommended for treating chronic pain. Opioids are a broad group of pain-relieving drugs that interact with opioid receptors in your cells to produce pain relief and sedation. Under certain circumstances, and when used correctly by a doctor, opioids can be helpful for relieving acute pain or pain caused by cancers. However, opioids are highly addictive. The more you use them, the less effective they become, so the more you need to take in order to relieve your pain. This process is known as tolerance. Eventually, tolerance turns into dependence, which means that you need to keep taking the drug in order to avoid withdrawal symptoms such as vomiting, muscle pain, sweating, and severe anxiety. This can have many negative consequences for your body, including a risk of overdose or death. Similarly, alcohol, smoking, and illicit drugs are also highly addictive and harmful for your body and should not be used as a treatment for any type of pain. As a rule, always follow your treatment plan and never take anything that hasn't been recommended or prescribed to you by your doctor. Tip number 3. Try cognitive behavioral therapy. Did you know that your emotions, thoughts, beliefs, and behaviors all play a major role in how much pain you feel? For example, let's say you wake up in the morning feeling sore, and the first thing that comes to your mind is, "Oh, I'm always in pain. This pain will never end." These negative thoughts can increase feelings of depression, which in turn can make you feel fatigued and unmotivated. As a result, instead of getting up and moving around, you may decide to stay in bed all day. By staying in bed, your muscles become sore and stiff from inactivity, which only ends up increasing your pain and further increasing feelings of depression. As you can see, this causes an endless cycle of pain and negativity to occur. Fortunately, there are many ways you can train your brain to stop having these unhelpful thoughts and beliefs about pain. That's where cognitive behavioral therapy comes into play. Cognitive behavioral therapy, or CBT, is a psychological intervention that can help you develop skills to identify and change negative thoughts, emotions, and behaviors surrounding your pain. For example, if you spend a lot of time worrying about your pain, CBT can help you change your thinking so you can better manage your outlook on life. CBT is provided by psychologists and trained mental health professionals, either face-to-face, online, or in small groups. Speak to your doctor for more information on how you can integrate CBT into your treatment plan. Tip number 4. Reduce your stress. When you experience persistent pain, you often feel stressed. When you feel stressed, your brain thinks you're in danger, so it sends out more pain signals in order to keep you safe. This only makes your pain more intense and harder to manage, causing you to feel more stressed and in turn experience more pain. As you can see, this results in an ongoing vicious cycle of chronic stress and chronic pain. The good news is, by regularly practicing stress management techniques, you can learn to disarm your body's stress response and in turn reduce your pain. There are many effective stress management techniques you can try. In particular, yoga and Tai Chi have been shown to be highly beneficial for reducing stress and pain. When practiced regularly, these techniques can lower blood pressure, reduce cortisol levels, relieve muscle tension, and improve muscle strength, tone, and flexibility. Another beneficial stress management tool is meditation. Meditation is a relaxation technique that involves concentrating on a variety of processes such as breathing, chanting, and visual imagery. The goal is to direct your attention and focus away from your pain so you can disarm your body's stress response and achieve a state of relaxation. Meditation is also beneficial for promoting a good night's rest by helping your body to calm down and let go of worries that may be preventing you from sleeping. Have a chat with your doctor to see what stress management techniques are most suitable for you. Tip number 5. Consider alternative medicines. As part of your treatment plan, your doctor may recommend that you try alternative medicines such as acupuncture or deep massage therapy. Acupuncture involves the insertion of long, fine needles into selected trigger points of your body in order to eliminate the sensation of pain. Although the mechanisms underlying the analgesic effects of acupuncture aren't well understood, acupuncture has been shown to have many benefits for managing chronic pain. In particular, a number of studies suggest that it works especially well for chronic back, neck, and knee pain. Deep massage therapy is another helpful alternative medicine for managing chronic pain. During a massage, a therapist uses pressure and friction to increase blood flow and block pain signals to certain areas of your body. This helps to loosen up tight muscles, ease body aches, and relieve built-up tension caused by stress. And because massages are so undeniably relaxing, they encourage your body to release feel-good chemicals such as endorphins, serotonin, and dopamine. These chemicals help to boost your mood, combat stress, and reduce negative thoughts, which in turn can reduce your pain. Tip number 6. Exercise regularly. Let's be real. When you're in a constant state of pain, the last thing you want to do is exercise. However, despite how unpleasant it may seem, exercise has many, many benefits for managing and relieving chronic pain. For instance, exercise releases endorphins, your body's natural painkiller. Endorphins not only block pain signals in your brain, but they also boost your mood and encourage a positive mindset, which, as you know, is essential for reducing and managing pain. In addition, exercise can help you maintain a healthy weight, reduce your risk of heart disease, lower your blood pressure, and control your blood sugar levels. And most importantly, exercise helps to prevent your muscles becoming deconditioned. When you stop using a particular muscle in your body, over time, it loses its strength and tone. So the next time you engage in an activity that uses that particular muscle, you may notice that it's more painful or effortful than what it used to be. This can cause you to avoid physical activity altogether due to feeling frustrated or fearful of causing yourself more pain. As a consequence, a vicious cycle of pain begins. The more inactive you are, the more muscle strength you lose, and the more fearful and frustrated you become, which only makes your pain more intense and harder to manage. A particular form of exercise that can help break this cycle of pain and assist with building up both your confidence and your muscle strength is hydrotherapy. Hydrotherapy involves carrying out a range of gentle exercises in a heated pool of water. The buoyancy of the water takes the weight off your joints, whilst providing a safe amount of resistance to help build up your muscle strength and prepare your body for regular movement. The warm water also helps to reduce pain by reducing inflammation and improving blood circulation. Hydrotherapy can be extremely helpful for teaching your brain that you are capable of movement and that getting out there and being active doesn't have to be scary or pain-inducing. Have a chat with your doctor to see how you can incorporate exercises, including hydrotherapy, into your treatment plan. Tip number 7. Shift your focus away from your pain. It's common to feel angry, anxious, and distressed in response to ongoing pain. However, when you experience strong emotions, your pain becomes heightened and extra sensitive. This can leave you feeling fatigued, low on energy, and depressed. Over time, this can cause you to withdraw, isolate yourself, and live a sedentary lifestyle, which only makes your pain more intense and harder to manage. Although it may seem difficult, try to shift your focus away from your pain by engaging in activities that bring you joy and make you happy. To do this, start by monitoring your pain on a regular basis by using a pain scale. Take a moment each day to rate how much pain you feel on a scale from 0, no pain, to 10, very severe pain. On the days where your pain rating is more manageable, try to fill your life with value-driven tasks such as reading a new book, listening to a podcast, learning a new hobby, or playing a board game. You can also use your pain ratings to communicate how you're feeling with your doctor or even your friends and family. The more you fill your life with things to do, people to talk to, and activities to engage in, the less opportunity your brain has to focus on your pain. It's also important to stay connected and maintain a healthy social support system. Dealing with the daily struggle of chronic pain can be extremely difficult, but you don't have to do it alone. If you need support, assistance, or just someone to talk to, reach out to friends or family. Or better yet, join a chronic pain support group. Support groups offer friendship, tools, wisdom, and information that you may find helpful for managing your own pain. They also offer a safe and welcoming environment where you can feel understood, accepted, and heard by people who truly understand what you're going through. Tip number 8. Be open to trying medications recommended by your doctor. It's important to remember that there's no single, universal medication for treating chronic pain. Because of this, your doctor may recommend that you try different types of medications to see what works best for you. For instance, your doctor may recommend antidepressant or anticonvulsant medications instead of painkillers. These types of medications have been found to be more effective in managing chronic pain, as they have less risk of serious side effects, such as tolerance or addiction. Finding a medication that works best for you can take some time, so talk to your doctor, listen to their advice, and try to keep an open mind about different medical recommendations. So, there you have it, 8 tips for managing chronic pain. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.